Welcome to our video on what to expect in recovery. At the end of the video, please complete the post-learning check-in found on the Family Learning Series webpage. This brief check-in will provide feedback to DDAP on the usefulness of this video and offers the opportunity for suggestions on future learning to possibly be developed. Individuals seeking treatment or support for themselves or a loved one can call the toll-free PA Get Help Now helpline at 1-800-662-4357. It's available 24 hours a day, 365 days a year, and staffed by trained professionals. A live chat option is also available online or via text message at 717-216-0905. For those seeking help who may not be comfortable speaking to a helpline operator, remember, you are not alone in this. By the end of the training, you will know the changes that can happen over time in substance use disorder. How to be an active participant in recovery. The role as a family member in recovery. Changes in the brain that occur during recovery. And how to work together in recovery. Let's get started. Recovery from substance use disorder is a journey of growth and development. Detoxification, withdrawal management, and treatment are only the first steps. One of the most important things to know is that recovery is an ongoing process. It is typically formal treatment followed by continued support from a sponsor, counselor, physician, 12-step group members, family members, and friends. It is a lifelong commitment, and it is hard work. It involves development of new critical thinking skills, increased personal growth, and learning ways to manage stressful situations without using drugs or alcohol. Many people develop a new spiritual aspect of their lives in recovery as well. Each person's path in recovery is a bit unique, and there is no one-size-fits-all way to recover. Recovery involves significant changes over time in personal identity and beliefs, family and social relationships, and daily lifestyle. These changes are about where you live, how you work and play, who is included and excluded from your life, and how you cope with the stresses of daily life. Recovery is more than just not drinking or using drugs. It is about putting together a new and meaningful life in which alcohol and drugs no longer have a place. Recovery is not like getting over an infection for which we can rest and take medication for a week or two, then get back to our otherwise unchanged lives. Recovery is closer to how someone successfully manages diabetes or heart disease, conditions that require sustained decisions and actions for life. Now that we have discussed changes that can happen over time, we'll discuss being an active participant and the roles of family members. You might be feeling hopeful and optimistic now that your loved one is engaged in recovery, and with good reason. There are millions of individuals and their families in long-term recovery from substance use disorder. Treatment works and recovery is possible. Here's some good news about recovery. Active participation in treatment, aftercare, and recovery support groups can significantly improve the recovering person's chance of permanent recovery, improve their quality of life, and prolong life expectancy, especially when your loved one is engaged in both professional treatment and recovery support groups. Some people take medications that help them manage cravings to use substances and make continued recovery more likely. These medications are not a crutch or a sign of weakness, but a valuable tool in recovery. Keep an open mind and trust that the professionals who are working with your loved one are suggesting treatment methods that will help them. It might surprise you to know that lifetime recovery rates of people with a substance use disorder are similar to recovery rates for people with other chronic diseases. The longer a person remains in recovery, the more likely they are to continue. Early days and months are the most difficult, as recovering people learn new ways to cope and live without substances. At this point, your loved one's main focus is on living one more day in recovery. Anything else is a bonus. Like many other chronic diseases, substance use disorder can reappear, even after a long time of not using drugs or alcohol. This is sometimes called relapse, or a return to excessive or problematic use. Remember, a return to use is not inevitable. Many people remain in recovery for extended periods of time, even the rest of their lives. You might hear people say, relapse is a part of recovery. Not true. Relapse is a symptom of the disease, and there are many things recovering people can do to prevent returning to use drugs or alcohol. You can help your loved one by learning as much as you can about the recovery process and having an open, ongoing dialogue about how they are managing recovery. Many times, a recovering individual returns to treatment, then enters recovery again with new knowledge and strategies to maintain a drug and alcohol-free life. It's important for family members to know that you cannot make someone return to using or stop them from using if they want to. Family members have no control over a loved one's recovery, but there are things you can do to support your loved one in recovery. Take care of yourself and focus on self-care. You have probably been paying a lot of attention to your loved one and what they need. Now is the time to focus on you. Remember that you could not force your loved one to stop using drugs or alcohol, and you cannot force them to continue in recovery. The only person you can control is you. Encourage your loved one to continue recommended treatment, work a 12-step program such as AA or NA, and to rely on the support of a sponsor and a higher power. There are many options for ongoing treatment and support, and no one must recover alone. At the same time, get involved in a support program for family members. Al-Anon, Nar-Anon, and Smart Recovery Family and Friends are good places to start. Your loved one will see you recovering, and likely will want to be part of your family's recovery. Your recovery as a family can positively impact your loved one's recovery. It's a win-win situation. Have reasonable expectations. The problems created by substance use won't be solved in a week, a month, or even a year. Learn to live one day at a time and address issues as they come up. Sometimes family members think that every problem in the family can be blamed on substance use, and that's not the case. There may be other issues under the surface that you'll need help in addressing. Be open to family counseling and to learning more about recovery so you can be realistic about your recovering loved one's journey. Pay special attention to any mental health concerns, as these often occur alongside substance use. Allow your loved one to take responsibility for getting to appointments, finding a job, and reaching out to others. Resist the urge to do it for them. Learn to let go and to detach with love. Now that we have discussed the roles of family members, we'll discuss changes in the brain. Don't attack your loved one with a list of everything they have done to harm you, or expect that anyone will instantly become a different person in early recovery. You need patience and compassion in dealing with your recovering family member, remembering that what they did while actively using were the actions of a person who is sick. Give recovery time and a chance to make amends for past mistakes. It might help to remember that your loved one's brain is healing, similar to how other parts of the body heal following an illness or injury. You will see evidence of this healing in things like your loved one caring about their appearance and health, their ability to keep promises and be honest, and their improved relationships. Before we wrap up this video, we'll discuss how you and your loved one can work together in recovery. Help your loved one plan for tricky situations. Together, make a list of the situations that might cause problems. Relationships, work, celebrations, or going out with certain friends. Pair each problem with a solution, creating a coping strategy for that high-risk situation. Suggest that your loved one discuss this plan with a sponsor, counselor, or support group members. Encourage your loved one to maintain a consistent, healthy meal schedule. Discuss establishing a sleep routine to prevent tiredness. Support having a healthy exercise program, any activities that lead to new learning, contacts with recovering people, and spiritual growth. Encourage friendships with sober individuals. Notice and praise progress and remember that each day of recovery is a big accomplishment. Participate in your loved one's treatment if you are invited to do so, and maintain contact with treatment professionals. You can be a big help in the recovery process by having an honest conversation about how your loved one is doing and how you can help. The journey of recovery begins with treatment of varying types and continues with ongoing support. It is not a sprint, but a marathon race. Your journey as a recovering family member is similar. You can learn about new ways of coping and interacting with your loved one, and continue to grow as a person and family member. Join in your loved one's recovery, but save space in your life for your own path. Reach out, get support from other families, and walk the path of a recovering family, one step at a time. Knowing what to expect when a loved one has a substance use disorder can be challenging. Remember to be patient. Changes happen over time. It is important to stay hopeful and optimistic, even in the difficult times. Keep an open dialogue with your family member regarding their recovery and how they are managing it. Work together to plan schedules, healthy meals, and discuss sleep schedule. The recovery journey is about trying different treatments and giving ongoing support. Thank you for watching DDAP's What to Expect in Recovery video. Please complete our quick post-learning check-in so we know how beneficial this was for you, and to offer any suggestions you may have for other videos you would like to see. Don't forget, you are not alone.